Hi, my name is James Ashford. I am the State Director for Oklahoma, for Vision Care Director of Oklahoma. I want to tell you a little bit about my story, how I got involved 7 years ago. I was at a point in my career where I was looking for something that was going to be something I could find value in. You know, we hear that a lot today, that we want to have value in what we do for a living and how we support our families. And so when I was approached by the opportunity to take over the state of Oklahoma, that really hadn't had a lot of effort put into it in the first 5 years of its existence, I was really intrigued by it. And the thing that I learned that sold me on this opportunity, and the reason why I wake up every day excited to do what I do, is the value of optometry. I had no idea that so many diseases, over 18 different diseases, are detected early in annual eye exams. Over 50% of the time, diabetes is detected at an optometry office, not at a physical therapy, because so many of these diseases and chronic conditions are things that we don't feel. And so, but because they show up in the eyes and the vascular system of the eyes before they show symptoms in the body, it's really important to have annual eye exams. And that's something that I really found value in being able to have, because I have two children that have had poor vision, and these are things that optometrists have been able to affect in a positive way for us. I also learned that, you know, in the market, there are some big giants out there. And so I like to refer to us as David versus Goliath. We are the company that is trying to do good in the industry, but we're not your $55 billion market company that's a giant insurance company. We are somebody who's in your community working with optometrists to do a best job for our brokers out there. And so that's what we bring to the table. Is one, we're a big part of our community. Everything that you do with us is going to affect your communities locally and not send money out of the state of Oklahoma. Now, we do operate outside of the state of Oklahoma, but those Oklahoma companies that we work with today, like the state of Oklahoma, that keeps all the revenue right here in the state of Oklahoma. So we like to give back into our communities. So you'll see us do things like we have annual teacher scholarships where we give out 6 $250 classroom scholarships to help the teachers with classroom resources where they may not have the ability to do that. We give back to different charities like, the Center for Handicapped Individuals. We give to, things like Shepherd's Fold that administers to children and teaches them how to be leaders. All of those things that we do in the community, and I love that aspect of it, and it's what makes me excited every day to go to work and fight this battle against these giants. So one of the things that I want to talk to you about is the value that we bring. We understand in the area of health, dental, and life benefits, vision is simply an afterthought in most cases. It's put on a spreadsheet and presented as here's your lowest premium price. But there is real value in a vision plan that you can bring to your clients as a broker if you truly understand what goes into that. So one of the things is we focus on the comprehensive eye exam. We pay our doctors more than any other plan out there for that reason, because we want them to be able to detect those early diseases. In fact, there's a study that was done by an independent company called KDD that did a study that showed that those patients, those employees with an annual eye exam, see a significant reduction over those employees that didn't have an annual eye exam and their healthcare costs. So we're suggesting a paradigm shift in many cases where we include the eye exam and let only the employees that wear contacts or glasses, let's sell them a plan for their contacts and glasses, but let every employee have an annual eye exam. That makes a lot of financial sense for anybody trying to control healthcare costs that are faced with annual increases year after year after year. Our plan also brings value to the employee, not to the broker and to the employer. The way we've constructed our plans is our premiums are not the lowest, but they're pre-tax at the time of purchase for those premiums. And then the employee, they get to see a huge savings on the other end when it's post-tax. So instead of spending $200, $300, $400, sometimes $500 to $600 out of pocket with no tax savings on it at the doctor's office, we've constructed our plans and built in discounts with our providers so that they can pay as little as $15 out of pocket at the time of service for a complete pair of glasses. We call it our Plus Plan program. Our Plus Plan program, when you see one of our Plus Plan providers, the employee automatically gets upgraded from a traditional lens to a polycarbonate lens. They get anti-reflection, UV, and scratch coatings at no additional cost. They also get upgraded from a trifocal or bifocal lens all the way to the no-line progressive, which can cost hundreds of dollars at no additional cost. So those things that would typically drive up the cost at a doctor's office that employees want and doctors want their employees to have are the things that we've covered on our plan. So we encourage you to take a look at the plans a little deeper and consider Vision Care Direct. We are the David fighting the Goliath, and we want to be the team that you select that helps you win.